Good afternoon. My name is Dominique Preston, and this is video 3 on ethical consideration. So, the first question asks, if there's a slight chance that an expensive experimental drug will prolong a dying person's life, should the insurance company or the health organization pay for the use of the drug? Well, I feel like just as a cancer patient or a person who would have AIDS or HIV, most of the time, if they have health insurance, it typically pays a portion while they have to pay the remaining. I would think with the experimental drug that the right thing to do would be let the patient pay a copay or a deductible while the insurance handles or the hospital handles the rest. Of course, with an experimental drug, it's always chances. So I would make the patient aware what the chances are, if it's going to work or not. Let them know that it is experimental, so it can't work, but I would give them the option to let the insurance pay what they can and the patient pay the copay or deductible. Number 2, if two patients suffer from the same condition, should they be treated differently? What if one is a child and one is very old? What if one is famous and the other one is unknown? What if one is homeless and the other one is a community leader? So while reading Dupree chapter 6 on page 140, it states, of course, you always want to give the priority to the person who has the highest chance of success of living. So between the older person and the child, I myself would choose the child, not due to age or anything. I just I agree with what Dupree said, and I believe that the child would have a higher success rate of living. If we were able to, I would give both a fair chance, but if I had to choose, priority would be given to the child. Number 3, if you could fund two of the following procedures, which one would you choose and why? So between surgery to help an infertile couple conceive, plastic surgery to improve the appearance of a person born with facial deformity, chemotherapy for a very sick person, drug therapy that might prevent a person from getting AIDS. So after reading all of those choices, I honestly, if I could choose, I would choose all 4. Me being a parent, I could not imagine if I couldn't conceive and have kids. I feel like so many parents or adults dream of that. So if it was something that could be possibly done to help them, I'm definitely on board for that. Plastic surgery to help facial deformities, well, who wants to be insecure all their life? So if it was something that could be done to help a person feel better on the inside as well as on the outside, I would choose that one as well. Unfortunately, chemotherapy, cancer sucks. I've known so many people that lost the battle to cancer. So chemotherapy, especially us being in the month of October, breast cancer, chemotherapy all the way as well. Now for drug therapy that might prevent a person from getting AIDS, now this would just depend if they have HIV and we're trying to prevent them from getting AIDS, or is it a drug that just prevents you from getting AIDS at all? That one I'm not too sure about, but if I had more detail about it, I would look into doing that one. Again, my name is Dominique, and that is my take on video 3, ethical consideration. Thank you.